Hello, everyone. My name is Evelyn Aqua, and I welcome you all. I am an Assistant Research Fellow with the University of Health and Allied Sciences and a member of ICOT Steering Committee. Welcome to our second Knowledge Exchange Café session that is titled Using Rapid Qualitative Assessment to Improve Mass Drug Administration, which will feature some of the authors of a report discussing how we can use rapid qualitative assessment to improve mass drug administration. Before we go on, I wanted to briefly explain what ICOS is for those of you who may not be as familiar with it. ICOS Community of Practice is a platform for communication, collaboration, and knowledge exchange within social and behavioral science research discipline to address implementation gaps and current issues facing neglected tropical disease programs. The Knowledge Exchange Café is one of ICOT's monthly initiatives, which will bring together individuals to network and learn from one another's research and experience. The emphasis in these discussions will be on the social and behavioral science as they relate to neglected tropical diseases and how they help reach the WHO 2030 NTD roadmap goals. Remember to register as an ICOT member so you can benefit fully from all we have to offer by visiting www.icot.org. Today's Knowledge Exchange Café will feature three amazing individuals. Professor Maggie is an associate professor at Georgetown University, and her specialty is in the design and evaluation of disease control programs using practical and multidisciplinary approaches with focus on lymphatic filariasis and other neglected tropical diseases. Dr. Elizabeth Sutherland is an evaluation and research specialist at RTI International for the Act to End NTDs East Project and an adjunct professor at the Milken Institute School of Public Health at George Washington University. Elizabeth Regan Fitch is a senior manager on the Monitoring, Evaluation, Research, Learning, and Adapting team in RTI International's Development Group. Without further ado, I will now hand it over to Professor Maggie Becker. Thank you.
Thank you very much, Evelyn, for that great introduction. And thank you all for joining us today as we speak about an approach that we've developed. This was with funding from RTI International on using qualitative research methods to rapidly generate recommendations on how to strengthen mass drug administration for neglected tropical diseases. I've been a professor at Georgetown University for the past year, and prior to that, I worked for 8 years at RTI International, including during the development of this project, together with Dr. Beth Sutherland and Ms. Elizabeth Fitch, who are co-presenting with me today. In the next 30 minutes, we will cover the following 3 points. I will cover why we developed this approach and our process. Elizabeth and I will then walk you through the approach, and Beth will end with anecdotes on how this approach has been applied in USAID's Act to End NTDs East program. In developing this approach, Elizabeth, Beth, and I also worked closely with Dr. Alison Krentel and Dr. Kevin Bardosh, who many of you know, 2 senior researchers with vast experience in the use of qualitative methods as applied to NTDs, and also with Elisa Jordan, who made sure the design of the final product was not only attractive, but user-friendly. Our development process was based on a human-centered design approach, which starts with the end user to understand what they need in a product. We therefore pulled heavily on the advice from people working in endemic countries that you see listed here on the slide. We did this through a series of one-to-one interviews, focus group discussions, small group meetings, and 2 think tank sessions. And then you can see the different global advisors we also pulled on here. Before I continue, let's get the feel for the experience of others in this room. So Afsa's just launched a quick poll here in Zoom. Hopefully you see it. Just 2 questions. If you could take a moment to complete it. Just enter your answers and then click submit, and Afsa will be able to share the results with us in just a second. Does it look like the results are coming in yet? Afsa, maybe we can look at the results. All right. So about 70%, just over 2/3 people have experience of using qualitative evidence to improve MDA, and 1/3 do not. So that's a good mix. It's great to see that we do have expertise in the room here, and we look forward to pulling on that in the question and answer session at the end. And then what qualitative methods have you used? Great to see expertise across the 3 different types that we mentioned here: focus group discussions, in-depth interviews, and participatory methods. Great. Okay, I'm looking forward to the question and answer session already. I'm going to have a lot more input from you. Okay, next slide. So, sorry, my slides are just slightly out of sync here. Give me a second. No, we're fine. Okay, so what is the approach? As I mentioned, it's an approach designed to inform MDA, especially when you find areas with persistent low coverage or where you're not seeing expected reductions in prevalence, and you wonder if this might be related to who the MDA is or is not reaching, or you have other reasons to suspect that you're missing specific groups. In looking through the questions that you submitted when you registered for this event, which by the way was really great to have these. Afsa, could you just click? Yeah, great. And one more time, thank you. I saw a lot of people asking questions like, how can we increase coverage in areas of resistance? Or how to identify and reach never treated populations when performing MDA? With several of you mentioning specific populations or contexts that we find harder to reach, like the ones that you see listed on the slide here. Let me be upfront with you from the start and say, we're not here today to give you an MDA blueprint design and answer to these questions. In fact, we don't believe there's a one-size-fits-all approach. Sorry, but don't all run away, because these populations have been harder to reach, require an approach more carefully designed and adapted to meet their specific context. What we are presenting today is an approach that will allow you to rapidly get the information that you need to inform such a design. Next slide. So how do we find the information that we need? Usually, when we are working to overcome a challenge, we consult the experts. And I pulled this definition of an expert: a person who has a comprehensive and authoritative knowledge of or skill in a particular area. When facing the challenges that we've just been talking about, members of the community, including drug distributors, are often the experts. They are the people who understand best who is being reached, who is not reached, and why. They understand the context within which we arrive with our MDA programs. Importantly, They are often also the people who can give the best advice on how to adapt MDA to overcome challenges. Qualitative methods can be used to engage these experts. Next slide. Some of you ask questions like, what are the major challenges to conducting qualitative assessments for mass drug administration? It was very important to us to also understand this before we started. In our consultation, this is some of the feedback that we got. Related to planning and data collection, there is limited time to make changes to MDAs before finalizing the design and the budget. We often only have 3 months in which we need to conduct a desk review, plan and conduct qualitative data collection, analyze and prioritize findings, and then plan adaptations to the next MDA. There is often no additional budget for qualitative investigations, and there is a lack of standardized tools for data collection. This, combined with limited expertise in conducting qualitative research, has often resulted in the creation of interview guides that were very long, which in turn generated very long lists of recommendations that could not possibly all be implemented. And as a result, some very useful information may stay buried and have little impact. Then related to analysis and reporting, we were told that there's no template for analysis or reporting results. This made the analysis process take longer, and the lack of guidance on how to prioritize recommendations, which is needed if the information collected is to be acted on. Finally, compounding this block to action, there was often a disconnect between those who now have the information and those responsible for designing, implementing, and making budget decisions related to the next MDA. What challenges have you faced? Let's take a minute. If you could just enter a sentence in the chat here of challenges that you might have faced in implementing qualitative research. We will return to look at your answers during our question and answer time. Just pause for a second and give you a chance to enter something in the chat there. And as you enter your answers, I'll make a quick plug for iCards, which has put in place mechanisms to address some of these challenges by maintaining a searchable database that can be used to connect programs to persons with qualitative expertise in their country or region. Visit iCard's website if you want to find out more. Great. Hopefully there's a few inputs into the chat there, and we'll return to these in our Q&A session. So with this information in hand, we were clear on what we needed to build, something that addressed the programmatic gap of needing to better understand who is being left out of MDAs and why, that can be used by people with little qualitative research training, that fits within routine programming and results in action, that is context specific, and that strengthens the quality of qualitative research being done. Because you see, qualitative research can be a dangerous tool. So many people think it's easy and that anyone can do it. And therefore, it's just too easy to end up with poor quality research. So let's walk through the manual that describes the approach together now. This is what the front page looks like. And the link to it will be added to the chat now as well. When you click on this link, or if you don't have this link later on and you're trying to remember how to get back to it, just do a Google search, NTD Toolbox Rapid Qualitative Guide, and it should pop up there as first in the results page. It'll take you to a page that looks like this. There is the main document that you see highlighted in green on this screen. It's relatively short, only 28 pages long, and there are 8 appendices, all linked to from the main document, that go more in depth on different topics. There are 6 slides in this approach that take you from scoping your study to conducting it, implementing the changes to MDA, and then coming back and evaluating what you did. It has been designed to either be used in its entirety, or you can just pick and choose sections. For example, if you have a lot of data already collected, and now you're wondering how to translate this into programmatic action, you could just jump straight into step 5. Here is a quick overview to the layout of the main document. Each step includes just a few pages of text interspersed with photos and graphics. There are links to other parts of the document, to appendices, and to other resources included throughout the guide. Each step ends with an output. That is why you should have, which is what you should have done once you've completed the step. Let's briefly go through each step now. Many of you have asked questions related to the choice of qualitative methods vis-a-vis quantitative methods, like the one that you see here. Do you think that qualitative assessment should complement quantitative assessments of MDA? How do you envisage both can be effectively integrated? I really relate to this question. One of my personal pet peeves is when I see efforts made to collect data when the knowledge already exists. It just seems such a waste in an environment where our resources are limited. We therefore included this first step, which is designed to look at existing information and, based on what you find, develop a specific research question whose answer will address programmatic gaps in knowledge. It leads you through a series of 10 questions to help you think more about the information that you already have. And it ends with this question 10. What is the most important knowledge gap that you still have that could be addressed with a rapid qualitative assessment? It includes a link to Appendix 1, which provides details on themes commonly associated with low coverage and people missed that can help you think through this more. It also includes a list to other activities that might have been done that will have generated potentially relevant information that you should check at this stage, including, for example, coverage surveys, post-MDA review meeting, or even assessments on similar challenges done by other public health programs. Finally, this section draws attention to the fact that a qualitative study may not be the best tool for you. For example, if you're trying to measure coverage or validate reported coverage rates, other tools are a better fit for those needs. It might be that step 1 is all that you want to use of this guide. When you start step 2, you should have a clear research question defined and know that qualitative research is the appropriate method to use. Now you want to decide which specific qualitative methods are best suited for your research question. This step introduces several methods that you might consider. A literature review that we did showed that in NTDs, we rely on focus group discussions and in-depth interviews most of the time, while other public health programs also use more participatory methods like the transect walk or calendars. Here you're given information on what types of questions or research question each of these methods is best suited to. For example, if you want to find out the best time of year to conduct MDA, you might use a seasonal calendar. You can then go to Appendix 2 for more details on each method, including to answer some other questions that you asked, how to select participants, and how you can apply. Sorry, let me say that part again. You can go to Appendix 2 for more details on each method, and this includes just to answer some other questions that you've also posed to us, how to select participants, and how you can apply the method virtually. Appendix 3 has an interactive bank of tried questions that you can select from depending on your topic. I want to give Alison Krentel a shout out here for sharing these openly from the research that she's done. And with that, I now hand over to Elizabeth.
Thanks, Maggie. So I'm going to start out by talking about step 3 in the guide. So we provide several factors that NTD programs should consider more broadly when planning for qualitative assessment. And each method described in step 2 also provides additional guidance on the steps required to implement the method, including the sampling and time required. So this step is really more in general and not specific to one method. So step 3 provides guidance on setting a plan for data collection, including human resource considerations. And you can see the question here on the slide from one of our participants about how to engage community health workers in this data collection. And so that would be covered in that section of the slide. A template for developing a simple protocol for data collection and analysis, and then recommendations for training. You can see here that someone asked about if there are training packages that can be provided at local levels. And so there actually is an appendix that provides a draft agenda for a 1-day orientation as well as a 3-day training with guidance on what to include in each session. It doesn't include presentations, but it includes how you would conduct each activity within the training, and then guidance for the types of things you would want to include. So there are many ways to analyze qualitative data, and for the purposes of a rapid assessment, we recommend using a matrix to quickly organize the themes from each data source. That could be interviews, focus group discussions, or additional methods such as transect walks. And those usually get included in a daily summary. And you'll hear from Beth a little bit later that this step 4 and step 5 are 2 of the sections of this guide that have been used the most so far in the work that she's done. So if we talk a little bit more about step 4 and what analyzing the data looks like, here's a completed matrix from step 4 that's included in the guide. First, you can see that you add a list of themes and sub-themes that come from both the desk review. So that's that quantitative data collection that you do at the beginning of this to see if you actually want to do the qualitative piece, and it's necessary to have that additional information. Any additional themes that you've identified during the data collection, and then you combine those into this one analysis framework. Then you ask the data collectors to review their detailed notes and daily summaries and complete the columns on major findings, illustrative quotes, and data sources under each theme. So something that's important here is that we recommend combining the themes from all of the different data sources that you have into one line so that you aren't repeating the information and you're actually triangulating where things are coming from. So then once this is finalized, you have to validate the analysis with the field team during discussions to make sure that this resonates with what people actually heard. Next slide. So step 5 is where we talk more about developing, prioritizing, and implementing the recommendations. So researchers and M&E staff and program managers all need to come back together for this piece. Researchers have the best understanding of the data collected in this study and how it can or cannot be used, while NTD program staff will have access to the knowledge collected by other means, formally and more tacit, and their role in interpretation and application is critical. These 2 or different groups can help check each other's biases and push for better solutions than you would get if you just had this being done in a silo. So in talking about brainstorming solutions, the nature of program implementation is that it will never be perfect, especially in the settings where NTD programs operate, the scale at which they operate, and the resources available to them. Therefore, it's very easy to detail a long list of things that can be improved, be they training, supervision, data collection, social mobilization, attitudes, or staffing. So we identified in this study something to facilitate this process that we liked, and actually comes from the water and sanitation sector. It's called the Risk, Attitude, Norms, Ability, and Self-Regulation Model, or RANAS model. And that's what you can see on the screen here. So the way that this works is that prior to a workshop, the team members that conducted the qualitative assessment transfer the themes from their matrix into this table and include sub-themes if they're relevant, and then complete prior to the workshop the where we are today. So this is, what does this theme actually mean? What does it look like? Then during the workshop, the team works through one theme at a time, and the group summarize they use the data summaries and other things that were done during data collection to complement this discussion. They then complete the 2 other columns in this worksheet, which are the where do we want to be next and how will we get there? and that's the initial brainstorm of the recommendations. So also in this step, we talk about prioritizing and planning. So, out of that theme analysis and list of recommendations, you will probably have a long list with too many things to take forward. So we recommend first comparing across themes to look at where some of the recommendations overlap, and then using this value versus feasibility matrix to actually prioritize what you want to implement. And so this was a question that we got from one of the participants is, how do you prioritize recommendations? And so we recommend on the x-axis looking at feasibility of implementation, which refers to the ease of implementation or the cost, time, and level of support needed. And then on the y-axis, looking at the value, which refers to the potential to increase MDA coverage or reach persons who are missed. And so depending on where your recommendation falls within this matrix, it helps you decide which ones would be worth implementing. So once you've decided to implement, step 6 is evaluating the impact. And so you want to make sure that you, after planning for the changes, you want to document what actually happened, evaluate the impact of those changes, and share learnings so that the program can continue to improve. So we recommend doing this ideally from existing information. This would hopefully be built into existing activities so that it's not an extra burden on the team. And because it's relating to improving MDA and reaching more people, you should be able to use some of the existing methodologies that are listed here that are done routinely within the NTD programs to collect this information. It could be possible that you want to know more about the reasons for or reasons that a change did not happen. And then that would be when you might want to conduct additional qualitative data collection to supplement these existing sources. So the guide provides a couple of example ways to monitor and evaluate the changes. And you can see them listed in the table here. And they talk about the types of questions you could answer with these different methods. So those are the 6 steps. We would love to hear from you now. We've gone over them. What do you think would be most helpful based on the challenges that you faced, and how might you apply it? Why would that step be helpful? And one of the things that, I think Beth will get into a little bit more in her section as you're writing down and sharing which steps that you think would be helpful is the fact that you don't have to use this guide from front to back. So you can pull out different steps that are relevant to your work and sort of the process that you're implementing. And you'll see that a little bit as Beth is talking. So now I will hand it over to you, Beth, and we will continue to bring up your comments in the discussion in a few minutes.
Thank you, Elizabeth, and hello, everyone. I'm very pleased to be able to give some examples of using or operationalizing the Rapid Qualitative Guide that we've undertaken as part of the End NTDs East program. This guide was developed, as Maggie said at the beginning of this presentation, by RTI International underneath the International Development Group, and we were particularly excited to implement it or operationalize it under ACT East because of the increasing use of qualitative methodology across the project. We have found that we have had real success and real value added by incorporating qualitative methodologies as part of investigating when we have a survey outcome that was unexpected, perhaps, or as a complement to coverage evaluation surveys, often to sort of pilot the feasibility or acceptability of new interventions or approaches in the field, and also to assess gender equity and social inclusion concerns, and to look at sustainability and health system strengthening activities, including financing and advocacy and governance types of activities. Just taking a look at the guide over the last couple of years, we provided support to the project in the form of virtual trainings or in qualitative methods that incorporated the use of the guide, and then one-on-one virtual support to our field staff who did something to collect these qualitative methods in the districts where MDA implementation is ongoing. We've been able to use the guide successfully to implement a variety of different qualitative approaches, including the focus group discussions and IDIs and KIIs that we've talked about in many countries, and then also to look at participatory mapping and calendars to get a sense of MDA timing, and often looking at calendars and mapping when working with mobile and migrant populations as well. And then, as Elizabeth mentioned, and I believe Maggie did as well, we've also found that we can draw real value from the guide in collecting qualitative data or analyzing qualitative data, even where we are not necessarily implementing the exact methods, qualitative methods that are discussed in the guide, by pulling on those appendices, the theme matrix and the prioritization process for programmatic recommendations. So we've been able to use those analysis tools in conjunction with some other qualitative methods, such as participatory social network analysis, and looking at prospective qualitative data collection as we do some process evaluation of various programmatic approaches and MDA strengthening activities. So that kind of goes into contributing as well to that step 6 of evaluating the priority recommendations that are implemented. And again, we've been able to use those as well for some of the governance and HSS activities. Next slide. So this is just a couple of photos from June of this year, a community mapping activity that took place in Tanzania as part of microplanning. This mapping activity is featured in the guide as a participatory method, and it's really exciting that we were able to include this as part of microplanning and to have that mapping exercise actually facilitated by district health staff, as well as national NTD control program staff, as well as ACT East staff. So this is something that was really able to be very successfully implemented with all the variety of stakeholders that we work with in implementing MDA. Next slide. Oh, thanks. And then this is an example of a seasonal calendar from Uganda, from a particular village in the Karamoja region of Uganda, looking at different groups such as the cultivators when they are moving in and out of the region, other mobile populations, and trying to find kind of an ideal window for the timing of MDA to be able to reach some of these mobile populations that are moving in and out of the implementation area. Next slide. Okay, this is another example from using the theme worksheet or the thematic matrix that Elizabeth talked about. This is from a survey outcome investigation that took place in Uganda, and just again showing that you can list your themes, the major finding, your quotes, and your data sources all in kind of one way to be able to quickly go through and see what your findings are, so that they can inform your prioritization of recommendations. And next slide. So that's just a very quick thumbnail sketch of some of the ways that we've operationalized the guide on ACT East. We are really interested in, of course, learning from you. And as we move into this question and answer period, I know we're going to have a chance to discuss and hear from many of you about your own experiences, since many of you have used qualitative methods for strengthening MDA programs. And before we move into that question and answer, I just wanted to make a quick note that there is a new task team from ICORDS coming on qualitative methods. This task team is forming, and the real hope is that we can learn from each other on how we can operationalize qualitative methods in an appropriate way that we can inform MDA and strengthen MDA for NTDs. There's an interest form, and I think ASA is going to, the link is on the slide, is also going to drop that into the chat. So I really welcome anyone who is interested in talking more about qualitative methods and sharing experiences of applying these methods and operationalizing them to join us in that task team. So with that, I am going to welcome Maggie and Elizabeth back for our sort of facilitated Q&A session. Maggie, I'll hand to you to start us off.
Thank you, Beth, and thanks, Elizabeth. Well done, kept to time, which gives us lots of time to now have a discussion. So thank you for listening to us for this last half hour. And as we move to a question and answer, it's not just question and answer, but really it's a broader discussion that we want to have. We will sort of first leave time for any questions that you have directed at us as speakers, but we'd also encourage a discussion among all participants. Not all questions have to be directed to us. You're welcome to direct questions to each other, to answer questions that other people have asked. This really is the ICORD's platform is about being a community of practice, and it's about coming together and engaging and sharing challenges and frustrations, and also sharing how you've managed to overcome and solve these. And we will also at some point circle back and look at the answers that you made here to the two questions that we posed during the presentation. But before, I kind of want us to stop talking for a second. So before we continue with that, just let me leave the room open for any questions that you have. And you are welcome to put it in the chat, but we also welcome you to put your hand up or just come off mute and ask your question directly.
Why are you talking to me about it?
Is that a question that we have? I think it was somebody accidentally coming off mute.
Can I go first?
Please. I'm not able.
Yes, hello everybody. This is Doris from Kenya, Doris Jomo.
Hi, Doris.
Hi, Maggie. I really enjoyed the presentation. The methods of qualitative data collection you have given, of course, generally speaking, most of them are the ones that we are familiar with. We have been using for those of us who have been doing using qualitative methods, and generally in implementation research for NTD elimination. I'm wondering about the participatory approach or participatory method that you highlighted there. I have used that before, but I'd like to know from you whether there are other ideas as to other participatory approaches. So what I've done previously is have participatory approaches together with the other old methods, focus group, in-depth interviews, and so on. How, what else would be your thought in terms of what do I say? Strengthening the way I've been doing it. I've been calling for meetings with the stakeholders, like before the implementation of the intervention, and then to understand what the wrong things might be and what the right things should be that maybe would help in improving the MDA coverage. So I've had it at two phases, where I have at the lower level, where I invite the lower level, so to speak, stakeholders at the sub-county level. Then I have the higher level at the county level, and then I put all these information together and I do it in minutes in a meeting, and notes are taken. Do you have other ideas that you could share with me that could be used as participatory approaches? Thank you. And then you could speak something a bit on micronarrative surveys. I think maybe I missed that. I have not heard it, and I'd like to learn more. Thank you.
Thank you so much, Doris, and welcome. Doris is one of our experts in NTDs when it comes to qualitative research methods. So it's great to have you here. Thanks for the question, but also for sharing your expertise. Beth, maybe I'll pitch this to you first, or Elizabeth, either one of you that wants to jump in, but I also want to pitch it back to the group and ask the group. I saw in the poll at the beginning, several of you talked about experience in using the participatory methods. So anyone that has answers to Doris' question, I welcome at this point.
Yeah, so in addition to kind of the seasonal calendar and mapping, and I think in the guide, there's also discussion specifically about transect walks, which is kind of a relative of mapping in a way. But we found some real success with some other types of participatory methods for MDA strengthening, including, I think I mentioned the participatory social network analysis, which was really incorporated into group discussions with communities to look at sources of health information, how trustworthy those sources were, how frequently they access those sources. And it gave us a really good picture about the variation in how different groups and different clusters with even, within a district are accessing health information and getting information about MDA, which could then inform our IEC materials. There's many other qualitative methods, ripple effects mapping and card sorting for prioritization. And there are many, and you mentioned micronarratives. And I think all of these there are so many different approaches, and they all can be of value, depending on that particular question or that particular hypothesis, I guess you might want to say, about why, what is going amiss perhaps, or what could be strengthened in your MDA, and trying to get that information that you need to make that programmatic recommendation. Elizabeth, over to you.
Yeah, sure. Thanks, Beth. So there are also a couple of other things that we include in the guide that can be implemented during focus group discussions that are more participatory methods. So those are things like group narratives, which are including change or outcome stories, and then also vignettes. And so there are instructions on how to implement both of those in the guide that you can then utilize to try and make your focus group discussions or other activities like that a little bit more participatory. Other things you can do would be like ranking and listing during a focus group discussion. And so there are also methods that you can integrate into sort of more traditional qualitative methods without having to learn a completely new methodology.
Thank you. And I want to also just to say that at this point, you can see everybody's thumbnails, everybody's names. It helps you to have a better idea of who's in the room. If you're still on kind of a one-person image, just go to the top right of your Zoom window where it says view, and click on that and select gallery. And that'll allow you to see the broader group. And you're welcome to turn on your camera if you want, no pressure. And yes, any answers from others in the group to Doris's question? I see in the chat, Mikkel posted a response related to ethnographic field notes. Would you like to come off mute and maybe share a little bit more about that? And introduce yourself first, please.
Hi, good morning, or day, wherever you may be. My name's Michael Jincole. I'm a student at University of Illinois, Chicago, and currently proposing dissertation research and using, among mixed methods, using ethnographic field notes, and I'm looking at how farmers markets interact with the food system. So it's not NTD related, but one of the tools I'm using is ethnographic field notes forms, and in terms of participation, I actually volunteer at the markets and then take notes and reflections in those forms after. So it's a highly participatory method. If you have any questions, I'm happy to expound.
Thank you. Great to get your input. And James, you've also put some ideas in the chat here. And I also wanted to come back to an earlier message you put in the chat about countdown tools. So maybe you could come off mute and tell us a little bit about all of these other resources and ideas that you have. Is James with us still?
Hello, everyone.
Hello, welcome.
Oh,
Again, if
thank
you could
so-
just start with an introduction and then continue.
All right, my name is James Nyanshi. I work on the countdown research here in Nigeria. Pardon me. So just a brief introduction about what countdown was. It was actually an implementation research into neglected diseases programs. And it actually was conducted in about 4 countries in Nigeria, in Africa, Nigeria, Ghana, Cameroon, and Liberia. So I'm talking about the stepping stone method. Now, simply put, we actually adopted that method to try to investigate how participants from communities understood challenges associated with NTD program implementation. Now, these afforded them the opportunity. When I say them, I mean participants coming from communities to share with researchers their own perception because we came from the background that as much as we are scientists, the people from communities also have fair knowledge of challenges that impede the NTD program. So we allowed a sort of a participatory atmosphere where we came together to discuss openly and in a manner that allowed them to make input. Now, the stepping stones were actually to, like I said earlier, throw the ball open for them to mention in specific terms challenges such as shortage of drugs or medicines, as the case may be, period of NTD program implementation, engaging people who are not acceptable by the communities to distribute medicines, and a host of other things. So this came up from participants in the communities, and as researchers, we documented these contributions, then now progress to the next stage of what can be done to ameliorate or to fix these challenges. And as well, we listened to them tell us what they think will be beneficial, will lead to these problems being surmounted. So, and a practical description would be where we gave out sticky notes to each participant to answer to specific questions being asked, such as what are the challenges, after which we gave another set of sticky notes to say, for them to answer the question, what are those steps that they think needs to be put in place to deal with these challenges. At the end of the day, we aggregated the causes both the challenges as the case may be, and the solution. So in a nutshell, that's what the idea of the stepping stone is about. Thank you.
Mute. Thank you, James, for sharing that expertise, and thank you for bringing up to the countdown tools and expertise. And I did want to give a mention for Laura Dean from Countdown, who engaged with us in the process of developing this approach and shared some great experiences from the Countdown experience too. So that was great. Thanks for bringing that up. Looking at the list of challenges, I'm hoping that quite a lot of these challenges you feel might have been addressed in the presentation that came afterwards, some of them in the discussion that we've been having so far. There is one I want to highlight and bring out right now, given that we're still in the COVID pandemic. So I was reading a New York Times article yesterday about, is it still pandemic or is it endemic, and how long that will be. But anyway, that's not our topic. Our topic is trying to get qualitative research done when there's still physical distancing being put in place at times, or wearing masks, which sometimes can make communication harder. What have people's experience been of trying to do qualitative research virtually as an option? And I know it's possible. In the past, it really hasn't been recommended as best practice, but I think maybe we're finding ways to get a little bit better at it. But I just love to hear from you and how anyone who's managed to do some virtual qualitative research and how that's gone. I have GW with a hand up. You unmute yourself and introduce, and please do.
Hi, everybody. This is Jordy Woods.
Hey, Jordy.
Changed my name.
I was thinking George Washington University there. Of course, I should have thought Jordy Woods.
So yeah, great presentation, y'all, and really, I think it's really timely to have all this going. One thing that we presented on the last Knowledge Cafe was some of the design work we had been doing for design of social behavior change interventions. And one of the things that we had to pivot towards in the pandemic was this design by distance piece. And so it was kind of qualitative research in terms of having a core group virtually, and then groups in the field. And so they would be going out into the field every day and then reviewing what they had sort of discussed. And so in some ways, it actually, I feel like, made the research even stronger, because we were able to triangulate between a group of researchers in the US or other places, along with the groups in the field in Ivory Coast. And every afternoon we'd come back and we designed all of the questionnaires and the things we'd be asking in the field together. And then the team would go out and come back at the end of every day. So it was a lot of work, as all of this virtual working is, but I do think it was, it didn't replace being there and experiencing all the questions, but it did give a chance to sort of also have an immediate touch point and validation of this is what we found, and having a broader group to kind of bounce that back and forth. So I think that was an interesting way to kind of pivot in terms of qualitative research.
Thanks, Jordy. I also see a hand up from Samuel. Can you please introduce yourself and go ahead?
Good morning from my end. I don't know if you can hear me.
Loud and clear.
Thank you very much. I am Samuel Saidu. I am a Mandela Fellow, doing 4 weeks internship at the Task Force for Global Health headquarters in Atlanta. So my own experience is not actually on the mass drug administration, but I was definitely involved in the qualitative research remotely through a telephone call where I made about 48 telephone calls, but that was actually based on the people living in slum settlement in Freetown. So during the COVID period, we decided to stop our qualitative data collections because it was community-based participatory research. So therefore, you are bringing together about 12 to 18 people in a small space in the informal settlement, and these are spaces that are really small. So the risks of interacting and contacting the disease was high. So we said, okay, can we find out what is happening on the ground so we can touch base with them? So we did a rapid, protracted assessment of issues that affect their own health and well-being during the COVID period. So we did we developed some guidelines and made sure that the tool was not, the interview cannot last like more than 25 minutes because we don't want individuals to stay so much on the phone as well. And there are other challenges of charging their phone. They don't have electricity. They want to go out to go and find work so that they can feed their family, etc. So we made the telephone calls, and maybe you call, maybe introduce yourself, and maybe the program we are doing earlier, which is actually called ARISE, which is the accountability and responsiveness in an informal settlement for health equity. You can go to ariseconsortium.org and you can see some more work that we have done. So we did those interviews online, but it was a kind of guideline that is similar to in-depth interviews.
Mm-hmm.
So it was a kind of individual in-depth interview guideline, and we made sure that they skip questions that they don't want to answer, or they try to tell us anything around what affect them within the COVID period. So it was a kind of guided, but also open, so that they can actually say what they want to say, especially if it is related to COVID. So that was actually an experience I had in an online qualitative data collection. Thank you. And it was published in the IDS bulletin. So you can go to IDS, Institute of Development Studies bulletin for 2021. You can find the link.
Thank you, Samuel. You might want to go ahead and put the link in the chat so that people can go straight to that. And thank you for that contribution with that. And our time has quickly come to an end, and I need to hand back to Evelyn as our moderator to wrap us up. But before I do, just to say thank you to Beth and Elizabeth as my co-presenters, and a special thank you to James and Samuel and Doris and Georgie and Michael, who all jumped in and shared their expertise with us. And, you know, if you want to keep having these kinds of conversations and you want to share more and have more time around this, sign up for the task group that Beth plugged earlier. And if you're wondering how to get more support for these tools, well, this tool itself is available online. The hope is it's self-explanatory and you can take it and work with it, but you can also pull on the iCards database to get experts that can engage with you and help you through it. So there's quite a lot of resources being made available now. With that, I hand back to Evelyn.
Well, this has been a great session, and thank you so much to our amazing speakers and to everyone who attended today. You will get an email with information about our next Knowledge Exchange Café. Hafiz will add all the relevant links in the chat box, including the link to indicate your interest in the MDA using qualitative research methods tax team, how to become an ICOF member, and a link to apply for our mentorship program, which I will briefly talk about right now. Please make sure you save these links before we end the session. We want to let you know that we have launched applications for the ICOLT mentorship program, which aims to provide opportunities for the mentorship of early career researchers, students, and young professionals in the field in the field of neglected tropical diseases and social and behavioral sciences. ICORS will do this by connecting mentees with experienced mentors in the field of NTDs, integrating various academic and professional institutions from around the world. The program is now running a 4-month pilot pilot program and is seeking applications from both mentors and mentees to join the first cohort, which will run from September through December 2020. We hope to pilot this with about 5 pairs. And with this, thank you to you and have a nice day. Thank you.